Joining me in studio to talk about some of the latest happening, or maybe not happening, up in Washington, D.C., Congressman Jodey Arrington. Welcome back.
Well, great to be back with you as always, Chad, and good to be with your listeners, and happy belated Independence Day to everybody.
Yeah, it was, you were busy this Independence Day. You went to a few different parades.
Texas Cowboy Reunion, which is, I commend it to everybody that can make that trip to Stamford, Texas. It's an awesome rodeo. My kids loved it. And then out to the amphitheater in Big Spring for fireworks and orchestra, very patriotic event. And then, of course, the big parade here in Lubbock. So it's been a great 4th of July for me and my family.
Right now, you're in the, I guess, what, is this the middle to the end of July 4th recess?
That's correct.
So everybody heads back to work next week, I believe.
Well, now see, I take exception. We feel like we work throughout the week because I've got 29 counties, and I'm out there. We listen, we engage, we participate in of course 4th of July events. But it's not just that. It's also coming to visit with folks like you so that we can get our message out to the voters and take phone calls and questions. I'm sure there are lots of questions out there. But yeah, in terms of us being back in the district, we've got a few more days left and then back next week for a big push before the August recess. And quite frankly, if we don't have our job done and our work done, we need to stay and work through August recess, as far as I'm concerned.
What does that mean as far as the job done? Obviously, there are a lot of big issues that y'all want to tackle. Are you specifically talking about health care?
Well, that would be the main thing because so much is connected to health care. You get too far out, and then you've got midterm elections. I think politics will take over, and you'll see a recalcitrant Senate. It's hard to imagine a more recalcitrant Senate, but there is such a thing, and it's what would happen, I think, if we get too far in the fall. So the main thing is get that health care bill done, and let's get it to the president's desk, and let's get on to tax reform. That's the linchpin to tax reform. Now, I'm on the budget committee, so the other piece of staying and doing our job is marking up a FY18 budget and a reconciliation component of that for tax reform and for mandatory spending cuts, which I've been talking about ever since I've been running for this, and now I get an opportunity to actually implement what I think is needed in order to reduce deficit spending and balance the budget. So we'll talk about that more as we mark it up. That should be in the next week or two. So
okay, so something to look forward to there. Let's talk a little bit about health care. I know it's all on the Senate side right now, and y'all are still waiting to see what the Senate is going to do. I don't know if the Senate knows what they're going to do. What are you hearing? There have been stories popping up about the Cruz-Lee plan, and the White House talking now about just repealing Obamacare and then replacing it at a later time. What's the latest as far as what you're hearing?
Well, I've never been big on replacing Obamacare other than replacing it with market reforms, okay? Freeing up the insurance companies to not have federal mandates, freeing up the states to take control over Medicaid and reform that program. And so, but we've all run and we all believe that you've got to repeal Obamacare, not just because we made the promise, but because it's been a disaster, and we don't have to repeat all the reasons and quantify all the ways it's destroying our economy and hurting our middle and working class families. The Senate has to have a sense of urgency here. We moved pretty quickly, I think, in the House, relatively speaking, to get it to the Senate. They're having the same struggles that we had, okay? You've got moderate groups, you've got conservative groups, you've got ultra-conservative folks like me, and I think Ted Cruz and Mike Lee are in that camp. They've got to find some compromise solution to get it so that we got Obamacare and get on with tax reform so we can get our economy growing. That's essential. I don't think you can wait beyond August recess. So I think that they have got the next, less than 30 days to deliver. I'm cautiously optimistic, but they still have a lot of things to work through.
Do you worry, and this phrase has been popping up more and more, that Republicans, conservatives, just Republicans overall are letting perfect be the enemy of good, and that everyone is searching for that perfect bill, that perfect piece of legislation? I don't know if it exists when it comes to health insurance and Obamacare. I don't know if that perfect bill actually exists. Are we in danger of getting there to where you got so many factions who want a perfect bill that we're not going to get anywhere?
I think there's two sides to this coin, okay? I think that you've got to have that debate within the conference. I think you've got to push as hard as you can, like I did on the House Budget Committee, defending not funding abortion providers, period. Not just and not just people abortions, but providers of abortion. So we went further than the Hyde Amendment. So there were things that we were fighting for, but at some point, you're right. There's never been a perfect piece of legislation. And I've always talked about that the way I would govern from the furthest right ideological point on the spectrum. I would fight hard and push hard, but at the end of the day, I'm the Ronald Reagan 80%. If you can get that 80%, then you need to take it, because if you wait too long, you'll lose the opportunity. We'll pay for it in the midterms. Most importantly, we won't deliver on what we promised. We ought to be held accountable for that. And that's just not, it's never worked that way. It's never worked that way from the foundation, from the conception of this country, from the forming the more perfect union with the Constitution. There were compromises struck. And now we're negotiating with ourselves. We're not even negotiating with Democrats. Yeah. So it's part of the process. We should expect this debate, but at some point, you got to be able to push something through that will go take a big step in the right direction, gut Obamacare, and get us going down the path of getting government out of our lives and off our backs.
How much do you hear your Democratic colleagues talk about, hey, if Republicans screw this up, single payer's right down the line. I know Elizabeth Warren's talking about it. How much of that talk is going on in D.C. and should voters be worried about that if Republicans can't get this worked out and, in 4 years, God forbid, you get a Democrat elected, you have Democratic Congress, are we marching that way?
I think that's what's at stake. I think that's exact. And they're just frothing at the mouth with the opportunity to move to that single payer system. That was the plan from the beginning. So yeah, they watch us and they try to drive wedges, and they use the national media who is on their side, and they want to get us in a state of confusion and division within our conference. We've got to just stay focused, as we used to say, keep your eye on the prize and run through the tape. We can get this country back, and we can govern as a majority for many years to come if we move the ball down the field and don't look for the Hail Mary every time we snap the ball. And I think we're going to get there. But right now, the Senate is in the throes of that debate, just like we were, a few months ago.
A question that came in via the text line, which is on this subject, and maybe this was addressed in the House bill that was passed. Maybe it's being addressed in the Senate bill as well. But Jesse asking, how can we remove the outrageous taxes on medical devices and supplies? Wouldn't that help make healthcare affordable instead of worrying about affordable health insurance?
Well, the key is to reduce the cost of healthcare. It's not just to get an insurance card. I mean, if the definition of success was having an insurance card, then you would say Obamacare had some effect on that. The problem is folks had an insurance card, but they couldn't afford the cost. They couldn't afford premiums or deductibles, et cetera. And we've had this explosion in Medicaid, this outrageous explosion in Medicaid beyond what it was intended. The poorest, sickest, elderly, pregnant women constituency, not able-bodied people who are over 400% poverty. So there's been abuse throughout this entire system. To his point, you've got to repeal the taxes in Obamacare. There's $1 trillion of savings in taxes that need to be repealed. Part of that is economic stimulus. Part of that is cost savings that'll go to tax reform, which will further stimulate the economy. The other part is, to his point, the more you tax innovation, the harder it is to bring new products and services to market. Technology and innovation is a part of the solution. I worked on telemedicine and telehealth before I ran for this job. And that's bringing the cost down for rural providers by having remote patient monitoring and providing medicine via conference call or via FaceTime. So government intervention does a whole lot of things that are not good. One of those is stifling innovation.
When we come back, we'll continue our conversation with Congressman Jodey Arrington. We've got some other things happening in Congress. In fact, a couple of bills that actually passed in the House that kind of got covered up by other news. We'll talk about that and some other pieces of legislation that will come up hopefully soon within the House. We'll be right back. Back on the Chad AC Show, News Talk, 95.1 FM, 790 AM KFYO. Congressman Jodey Arrington, our last segment with him. He's in studio with us today as he continues to travel around the district, visit with voters, with citizens, hear their concerns. Are citizens talking to you about the Farm Bill? Is that something that has been on their mind?
Yeah, the Farm Bill, obviously for us in West Texas, is critical because of the cotton issue, but also because the Farm Bill of 14, which is what we're living under now, it's a 5-year time frame, was done when prices were at an all-time high. Then they went in the tank, and so I would say we've got to really recalibrate the safety net for it to work. I mean, every commodity group is suffering, and you have low cost producers that don't play by the same rules we do, like China. So you have to have a good safety net. It's got to be responsible fiscally, but it's got to be reliable. And this one needs some reforms. Yeah,
you said it was a 5-year bill. Does it need to be a 5-year bill?
Does
it have to be a 5-year?
Doesn't have to be, but you know what? I'm going to speak to the positives of that. I think there's pros and cons with everything, but continuity for the market is important. If you ask folks in any industry, they'll tell you the worst thing is the volatility of government policy. If they could just lock something in, now they want lower tax rates, they want lower regulatory cost and burden. I mean, and that's what we're fighting for. But they would take, we go back to that perfect being the enemy of good. They would take the 80%. They might take 60% if they could lock it in for a longer period of time. By the way, that's part of the tax reform debate. You could do temporary tax cuts like we did in the Bush administration, and you could do higher tax rates. You could do more aggressive tax restructuring, but we want permanent. That will help the market come back. That will strengthen our economy and get people back to work better than I think these temporary fixes. So it's a good debate to have. I think there are probably some downsides to doing it, but I like stability because our farmers like stability, and so does our market.
Let's talk about there were two pieces of legislation that the House passed before the recess. And two pieces of legislation, I think it got covered up by, tweet news and all that other stuff, but Kate's Law and one dealing with sanctuary cities as well.
So national security, job number one of the federal government. Trump, I think, has been doing his part just by enforcing the law. You've seen a major drop in the flow of illegal immigration across the border. Kate's Law is going to stiffen the penalties, passed out of the House, now onto the Senate, but it's going to stiffen the penalties for those who are deported and then re-enter. If you are a criminal alien, your maximum sentencing now has gone to 25 years. If you are not a criminal alien but have by virtue committed a crime by coming across the border for the second time, you have a maximum of 2 years. So stiffening the penalties, I think we should do more, quite frankly. I'm a co-sponsor of the Davis-Oliver Act, and that would actually put minimums in, not just maximums. See, if you have sanctuary judges, they don't have to do that.
Right.
I'd like to have a floor. So there's more to come there. I think we'll get the Davis-Oliver on the floor of the House. The other is no sanctuary for criminal aliens, and what we've done on that is we're going to hold sanctuary cities accountable, but not giving them federal monies if they are harboring illegal immigrants and not working in coordination with federal law enforcement.
Now, both of those bills have to go to the Senate. It's kind of iffy, at least on the last one that we just spoke about, if that one's going to pass in the Senate.
Kate's Law has we had some bipartisan support there, some Democrats that support us. I think we'll get that through the Senate. Yeah, you're right. The No Sanctuary for Criminal Aliens Act is going to be a steeper push.
Yeah. What else is the House working? Because I know you guys are working hard. You're doing you're getting other pieces of legislation ready to be voted on. It's it's not just a holding pattern for repeal and replace and then moving on to tax reform. What are some of the other things that y'all are working on in the House?
Well, let me remind your listeners and the folks who helped get me here and put their trust and confidence in me that the House has passed 160 some odd bills, the most in modern era since Harry Truman. Okay, we've had 14 major regulatory repeals that protect our gun rights, that keep education policy at the local and state level, and so on and so forth. All 14 of those bills made it to the president's desks. He signed them, saved billions of dollars, 4 million hours in paperwork filing, et cetera, et cetera. So we've already made big pushes and I think achievements on the regulatory reform. We passed the House healthcare reform. And now as a member of the Budget Committee, the only Texas Republican on the Budget Committee, we're going to mark up a budget that's it's going to be significant. Rebuild the military, reduce our mandatory spending, which is the driver of our national debt, and build that reconciliation piece mechanism for tax reform. We're working that. I think when we get back, there's a chance we could mark it up next week. So I'm spending more time on budget and tax reform and all these reconciliation packages like the one we use for healthcare than I am on anything else. At the same time, we got a farm bill opened up, and that's obviously for this district and this region is priority number one. So, and then I'm a chairman of a VA subcommittee. Greatest honor I have is to be there to serve those who served us. And we passed VA accountability reform. They've been working on that for years, Chad. And the president signed it, and we're holding the VA employees and the VA leadership accountable. They can get rid of the poor performers and people involved in misconduct and start to focus on their customer, which is our veterans and our taxpayers. So I think that's huge. Yeah. I've said all along that that's the heart of the problem at the VA is it's a bureaucracy, it's a monopoly, there's no incentive, there's no accountability, and so we've got to reform and restructure in a big way the VA system. We've taken major strides, and I'm proud to have been a part of that on leadership of the VA committee in the House.
Has there been any discussion, any movement on there are a couple of gun bills that have been brought up before, the National Reciprocity Act,
yes,
which has been brought up, I know, at least talked about a little bit in the Senate, or at least by Senator Cornyn. And then also, I'm not sure what the official name or unofficial name would be, but dealing with suppressors, silencers, making those a little bit easier for people to purchase.
I think they're going to both come to the House. I'm a co-sponsor of both, and I'm helping push to get the votes so that we can bring it to the House. There is a process. The leadership needs to see that there is a threshold of support. They don't want to bring something just to bring it and it die. So yeah, that's the reciprocity bill I think is huge for our Second Amendment rights. And I think you'll see that on the House floor soon.
Is that one of those that it's maybe shakier in the Senate because of the Democrat, the vote threshold there?
Unfortunately, everything, including those, are going to be shakier in the Senate, but we're definitely going to get it out of the House.
Congressman, appreciate your time
Great
as
to
always,
see you.
And we'll let you go visit with some other folks and some other cities here on the South Plains.
You bet. God bless you, Chad. God bless West Texas.